1, 2.
Hi, this is Becky Sheets. I'm the CEO of Care Net Pregnancy Resource Centers, and I'm delighted to be here 6 feet apart from Dr. Harry Beaver, our medical director. And Dr. Beaver is going to give us an update today on some of the things that we're doing to be prepared and to do the best possible things that we can do for our patients and our staff here at Care Net Pregnancy Resource Centers as we remain open in our Woodbridge and Manassas centers. So, Dr. Beaver, let's just start with a little bit of your background with the Ministry of Care Net Pregnancy Resource Centers and in medicine in general.
Okay, well, I've been around for a long time here at Care Net for some 19, 20 years now. After having been in my 6th decade in medicine, I was interested in and drawn over here a number of years ago with an article from Focus on the Family, inviting others not yet associated with CareNet to be involved, and I came over, and it appears that they were looking for somebody, had an ultrasound machine, and no medical director to run the clinic at that time. So I became involved with that sort of an invitation and have been here ever since. Delighted to be able to use some of my training and experience to organize and run the medical side of the clinic here with our medical staff, and for the interest of patients and clients, as you all call them.
Well, Dr. Beaver, your impact in the ministry is incredible. Your impact for life, you have changed the course of lives for so many babies, so many moms, so many dads. So we're so grateful to you. And as you know, we are in the midst of very challenging times. So what are some of the things that we're doing differently? As a medical director, you oversee the medical practices, the medical part of our ministry. What are some of the things that we're doing to prepare for this very, very challenging time in the face of a global pandemic?
Well, as in other medical organizations, we of course have a policy and procedures manual, which we've developed specific to our situation here, which leads us and keeps us straight in terms of doing the things that are associated with this new experience for us with the global pandemic. So we're doing the screening things that are suggested by the CDC and our NIFLA organization to protect our staff and the patients from each other, and with the temperatures and the oximeter, when we get that going, to check the patients and the staff when we come each day. We're using the masks and keeping our distance, as you mentioned, Becky, from each other, and particularly when doing the ultrasound examinations, which we have to break 6 feet apart in order to get the technician to be able to do the examination on the patient. So, but we're using protective masks and gloves, of course, and so on to protect the staff and the patients as well. So we're doing what's recommended by the usual organizations, the CDC, and what's told us by the President's Council down at the White House.
And we're doing a great deal more cleaning,
Indeed.
Cleaning between patients as well.
Right.
Dr. Beaver, why is it important that our work continues during this time? Why is it important that we don't just stop?
Well, we're classified by the government and by the medical organizations as a necessary and function that's needed in times of crisis and change like this. So we're only doing what we need to do to keep things working, we're doing some working from home with the administrative sort of thing, and I'm checking the ultrasounds by way of electronic means from my home when we approve those. We're doing all that we can to get everybody seen when they need to be seen, and these are necessary appointments, like some doctors and clinics and so on are doing very minimal face-to-face organization type, but some with telemedicine and so on. So we're trying to keep functioning as we need to for the patients, and keep ourselves and them safe as well.
That's right. And we understand that in Virginia, abortion clinics remain open. The
Indeed.
governor has determined that they should continue to stay open. So it's that much more important that we are here to do the work that we do.
Certainly.
In the face of that in this time. Dr. Beaver, in your years caring for moms and caring for pregnant moms and babies, have you ever seen anything anywhere like what we're facing currently?
No, I've been asked that before too, and old as I am, I'm not quite old enough to remember the Spanish flu in 1918, and with that exception, historically, I don't think there's anything that approaches the strain that this has put on the whole country, and but on commerce and the economy, and certainly on the practice of medicine and the care of patients, both inpatients as well as clinical outpatient work, which we're of course involved in.
My last question for you, Doctor, how can our friends pray for us in this season?
Well, I think the same thing that might be recommended by our pastors and so on when we're confined and separated. We need to keep in mind that the Lord is still in control, and He isn't without full knowledge of what's going on, but we need to, with thanksgiving and supplication, keep in mind that we need to present our needs and our gratitude to the Lord for watching over us and allowing us to continue to care for the patients and their unborn babies, and so just in any way that we can be held up before the Lord in the way of our work. We're not terribly concerned about the financial part because we don't charge the patients, and it's not in that. We certainly need to have financial support to keep our operation running, but to keep us safe, to keep us working wisely and to the best advantage of the patients and the safety of ourselves.
Well, thank you very much for updating us, and thank you everyone for listening along and for praying for us. We're so grateful for you, and we're so grateful to you, Dr. Beaver, for everything you've done and will do for the ministry. Thank you.
Thank you.